Good morning, everyone. Today we continue our series in updating the country on our efforts to beat back COVID in Barbados, beat back COVID-19. And very important, you know that this weekend we move from pause to stop. Here to give us more guidance and information relative to what the law requires, what is in the directive on this occasion, how different the two periods are going to be, what is required of us as members of the public, are the Honorable Dale Marshall, Attorney General of Barbados, Mr. Tyrone Griffith, Commissioner of Police of Barbados, and to continue our discussion on issues relative to health and medicine, because COVID-19 has so very many components at both the social and economic levels, as well as at in terms of the area of the law, and in terms of the area of management and self-management, and of course health. Dr. Shani Williams. She is a consultant in the Accident and Emergency Department of the Queen Elizabeth Hospital. She is also engaged with the Director of Medical Services of the Queen Elizabeth Hospital. Yesterday we had that director, Dr. Clyde Cave, here with us, who spoke on general issues as well as a particular situation involving a new disease, relatively new disease, relative or consequence, the sequelae of COVID-19, MIS-C, or as some people say, MIS-C, multi-inflammatory syndrome in children. So he spoke in dual capacities in relation as Director of Medical Services, as well as in his own specialty as a pediatric specialist. Dr. Williams will do a similar thing. She will speak about A&E in particular, but she will speak in her capacity as virtually Deputy Director of the QEH Medical Services relative to what is happening across the QEH system. So this morning I think that we will have a comprehensive discussion for you, and we start therefore with the Attorney General of Barbados, the Honorable Dale Marshall. Attorney General, what's the new directive? What does it mean for all of us?
Good morning, Liz, Commissioner, Dr. Williams. Good morning, Barbados, members of the press. The Prime Minister has very generously excused me from the rest of Cabinet so that I can participate in this morning's press briefing, and I'm happy to have the opportunity to do so and to talk generally about the directive. We are now at Directive number 4. Directive number 4 became effective as at midnight last night, and you will all know that it will continue until the last day of February, the 20th of February at midnight. Now, let me begin by saying that much of what has been contained in the prior directives, much of those specifics have been continued into this one. So there's not a lot that's different. However, those places where differences do occur, I think that they're quite significant, and I'm going to take the time to go through them. So the first thing, let me reiterate that this directive came into effect at midnight last night and will expire at midnight on the 28th of February. You will all know that there's a curfew in Barbados from 7 p.m. until 6 a.m. But of course, I think any Barbadian will recognize that there have been a large number of vehicles on the road during the daylight hours, a lot of people moving about during the daylight hours, and we get the sense that Barbadians are not quite understanding what is expected of them. In fact, they're operating on the assumption that the only time that they have to stay in their homes is from 7 in the night until 6 in the morning, and that during the daylight hours they can do as they please and go hither, thither, and yon. We think it's a common sense thing, but for those Barbadians who seem to feel that they have carte blanche during the day, we have stipulated in this directive now that during the daylight hours, unless you have legitimate business with any of the exempted businesses or any of the essential services, unless you are to do any of those things, then you are expected to stay within the curtilage of your home. We understand that curtilage is a bit of legal jargon, and people are wondering, well, what do you mean by curtilage? Essentially, we simply mean the enclosure within which your house is contained, the boundaries of your property. So if you live and the front of your property is the public road, then that is the front part of your curtilage. Your neighbors' properties would be the ones to the left, to the right, and perhaps to the back. So curtilage, while it is a legal term, it means nothing more than it means nothing more than the extent of your property. That's basically it. If you live on a large piece of land, then you will have more curtilage than anybody else. But essentially, we are talking about within the boundaries. So when we say that you're not to leave your residence, we're not saying that you dare not step outside of your home. What we are saying that you can go outside of your house, but you cannot go any further than the boundaries of your home. So let's recap this. There's a curfew in place from 7 in the night until 6 in the morning. During that time, you're only allowed to leave your home if you are a member of the essential services or in the case of an emergency. Other than that, you stay within your property. During the daylight hours, think of that as an expanded arrangement. So you are allowed to go to the pharmacy. You're allowed to go to buy bread. You're allowed to operate your businesses as long as it's exempt. Those are the kinds of things you're allowed to do during the day. However, if you are not engaged in that kind of activity, you are expected, you're required, in fact, to remain at home. I think that's hopefully, I think it's simple. Now, when you think about Minister Bostick's exhortation yesterday, that takes us into what we are now calling stay home weekend. And I think the time frame that he gave for that would be 7 tomorrow night until 6 a.m. on Monday morning. We've, as they say, tightened the screws a little further during the Saturday and Sunday period. So we have required in the new directive, and that is to be found at clause 8 of the new directive, and we're saying that Saturday 20th and Sunday 21st, you are required to stay at home, but there are also certain businesses which would ordinarily have been allowed to open during those times that we're closing. So, for example, we're allowing bakeries to open for the purpose of baking bread for Monday, but bakery depots and so on are not allowed. So those of you who had anticipated going to buy bread on Saturday or on Sunday, I'm afraid that opportunity is no longer going to be there. Gas stations are going to be closed on the weekend. Gas stations are going to be closed on Saturday and Sunday. And we anticipate that Barbadians will say, well, but what if I need gas? Well, if you think you're going to need gas, please use your common sense and fill up tomorrow. Fill up on Friday. Wait until Monday. But what we're doing is we're eliminating for Saturday and Sunday those other things that Barbadians would have anticipated they'd be allowed to do. So the beaches are closed Saturday and Sunday. Parks are closed Saturday and Sunday. The opportunity that you have to do outdoor exercise today and tomorrow Saturday and Sunday, that is now, I regret to say, eliminated. So while today and tomorrow you can go outside and do your exercise, you can do your jogging and so on between the hours of 6 a.m. and 9 a.m., that will not be permitted on the weekend. So exercise, going to the beach, those kinds of things, going to the park, that window is effectively closed. Now let me say this. The one excuse that is available to you if you are found on the streets is that you have a pass. Let me say that it has come to our attention that a number of employers have been issuing to their employees letters saying that they're working this place and it's an essential service and therefore treat this as a pass. The only emergency passes that are issued in Barbados are passes issued by the government of Barbados and approved by myself as Attorney General. So those of you who have been using letters, the police will not be accommodating that. Please go to www.gov.bb, www.gov.bb, and apply for your passes. Letters will simply not be accommodated. So for those of you who have letters, please anticipate that will not be accepted, and not just on the weekend, not generally. In relation though to churches, we have made a decision that we will allow the religious arrangements to continue. So even though it is stay-at-home weekend, we will still allow people to satisfy the importance of their religious experiences, and therefore the arrangements in relation to places of worship will continue to be available over the course of the weekend. And just to remind you, religious services, no more than 10 persons can be present either for the service or for the streaming of that service. In relation to funerals, if there are any funerals on the weekend, and Barbadians don't do funerals traditionally on Sundays, that's a Saturday thing, that limitation continues. No more than 10 mourners, 1 officiant, and the funeral director. And not that we anticipate that there are going to be many weddings, but the weddings will continue to be constrained and can only be attended by the bride, the bridegroom, 2 witnesses, and the marriage officer. Now, notwithstanding the fact that since January began, we have banned limes, picnics, and all those kinds of recreational activity, Barbadians are persisting in that kind of event. I'm happy that the COVID monitoring unit has been able to bring some individuals before the court. Barbadians will have awakened to a headline this morning pointing out that certain people have been brought before the courts and are actually on remand for having limes. Please, please, please desist. The COVID monitoring unit is being very vigilant, but it is also being very strict. Some shopkeepers are anticipating getting the financial assistance from the government. And I believe that I need to say to you that if you are expecting to get financial assistance from the government, but at the same time are guilty of breaching the protocols, you will be denied that assistance. So let me repeat myself. For those owners of shops who have applied for assistance from the government, if you are opening your shop in breach of the protocols, that assistance will be denied you. Liz, I think I'll stop there for the moment, and I welcome any questions that might be posed so as to clarify what else is in the directive.
Thank you very much, Honorable Attorney General. As indicated, this morning, the Commissioner of Police of Barbados is with us, and he is going to tell us Commissioner, some of the concerns that you have, what have been the principal kinds of infractions that you have been seeing, you and the police force have been seeing, and how are you dealing and proposing to deal with these going forward, and how have you dealt with those that you've seen to date? Can you bring us fully up to date, please?
Thank you, Ambassador. Good morning, fellow participants. Morning to the media, and good morning to Barbados. I would start by saying that for the last, the period 3rd to the 17th, the force have brought some 20 cases of curfew cases before the court. So, which to my mind is 22 many. By and large, Barbadians are following the protocols. However, there are those few persons that continue to flout the directives. We're seeing persons still attempting to open shops and other businesses. We're seeing persons not wearing their masks, but especially not wearing their masks appropriately. We are also seeing instances of people crowding at the beaches, and we are looking closely at that. I would want to say at this stage that going forward, we will have a zero tolerance policy in terms of persons breaching the directives. I think we have warned sufficient people already. We work closely with the COVID monitoring unit. We work also closely with a team of compliant officers, and they have been, themselves have been warning several people. The reports coming back from them are that the people normally would correct their shortcomings when they're spoken to. However, they're saying that consistently they're coming across persons especially not wearing their masks appropriately. So it would seem that the people are aware that they must be wearing their masks, but yet they're not wearing them appropriately. And in that regard, they are now going to be calling in far more instances of people breaching the protocols, and police responses will be one of zero tolerance. There's some 15 teams of 2 to 3 persons going across the country, the 3 territorial divisions, performing that function. And they have been working well, and it's now for us to take it to that stage where we will be taking more persons before the court that fail to adhere to the protocols.
Thank you very much, Commissioner. There have been some complaints made by individuals that people are leaving home just for an outing. So you don't ordinarily go to the beach, but you get up early and a group of friends and you go to the beach. Or you leave home, you drive to the gas station, you go into the Automart, you pick up a pack of chips and 2 pack of nuts, and you circle back and come down because you want to leave home. You go to the supermarket, you have a can of corned beef and maybe some juice or something. But the whole purpose has been to leave home, to get out of home. What has been the response of the RBPF to this, and how do you speak to persons who find an excuse not to comply when they really don't have the need to be out of the house?
Well, we don't take pride in arresting people or putting people before the court. However, we think the situation is such now that we have to pull out all stops, and going forward, we are going to be closely scrutinizing all those persons and ensuring that they have good reason to be there. So I'm asking and I'm appealing to members of the public to adhere strictly to the protocols. I'm also going to ask that members of the public, civic-minded Barbadians, call in instances of breaches that they experience or hear of to the police so that we can take strong action in relation to those matters.
Thank you very much, Commissioner. Ladies and gentlemen, you've heard it from the Commissioner himself. We turn now to Dr. Shaney Williams of the Queen Elizabeth Hospital, attached to the Office of the Director of Medical Services, but whose substantive post is the consultant of the Accident and Emergency Department. Dr. Williams, thank you so much for joining us this morning. A couple questions to you, please. Generally, speak to us really about what the Queen Elizabeth Hospital experience has been. We're following in the news internationally of hospital systems being completely overwhelmed by COVID-19. How would you compare the experience of the Queen Elizabeth Hospital at this time? To what extent are you taking measures, and indeed what sort of measures to protect your staff? And how are patients presenting at A&E? Can you give some guidance and advice to persons in the public listening to this today? Do they come to E&E? Don't they come? When do they come? At what stage? What should I, as a member of the public, as a Barbadian, what should I be experiencing or feel that makes me say, yes, I need to go to A&E and I need to go now?
Good morning. Thank you, Ambassador. Morning to Barbados. As you would have heard over the last several weeks about the Queen Elizabeth's response to the COVID pandemic. And we have been planning well before our first case in March of 2020. Fortunately, the majority of 2020, the numbers were sporadic, affecting the emergency departments and the Queen Elizabeth Hospital in particular. And yes, as we all know, with the advent of community spread, the Queen Elizabeth Hospital has also been impacted and affected by members of our fraternity as it relates to being affected and infected with COVID. Our strategies were implemented, and fortunately, we are not in a position where we are completely overwhelmed, as we were trying to mitigate against that several months in advance. The containment strategies of having persons isolated in facilities not within the walls of the Queen Elizabeth Hospital have been to our benefit, as we are the lone hospital offering tertiary level care to the public of Barbados. We still wanted to maintain services, as a person still will be delivering babies, surgery still needed to be conducted, dialysis still needed to be conducted on a daily basis for our public. And yes, the emergency department still needed to stand ready to take care of the needs of urgencies and emergencies for the public. Strategies that we are engaging to help preserve our resources, both human and supply resources, so that we can continue to maintain routine services, urgencies and emergencies at the Queen Elizabeth Hospital. We still are trying to allow our staff members to have vacations. In the first lockdown of March 2020, we did suspend vacations. We recognize that this is a long process. Our staff members are becoming tired, and we're still allowing them to have their mental health breaks and their vacations as needed, so that we can also maintain our services for an indefinite period of time. Our resources, supplies, and equipment resources, we're trying to also preserve those, and that is why many of our outpatient services have been curtailed and our elective surgeries have been curtailed at this time, so that we can have the resources to respond to emergencies and urgencies. As it relates to the emergency department, persons may come with all levels of acute of severity as it relates to persons with COVID-related illness. So we may have the asymptomatic person with a non-COVID related complaint, or we may have severe illness as it relates to COVID presenting to the emergency department. As you would know, and we're saying this every day, we're treating all persons as though they are potential carriers of COVID. So we are wearing our personal protective equipment appropriate for the level of activity that we're doing. It doesn't matter what activity we're doing, even relating with our colleagues. This is why we're wearing our masks every day, all the time, every time. So the emergency department's response was we separated ourselves. We're now on 3 floors. The original emergency department, the ground floor where the antenatal and hematology clinics were located. They have been relocated to an annex facility in 6th Avenue, Belleville. And then we also have an assessment unit, short stay unit, holding bay type area on one of our floors. And this is so that we can separate those people who are COVID suspected or likely to have COVID from those low risk or less likely to have COVID, and we can continue care and treatment for those patients. We have had in the last week at least 10 persons who have been diagnosed as positive for COVID in the emergency department, and they presented with respiratory complaints or non-respiratory complaints and have made the diagnosis and had to be they had to be transferred on the confirmation of the COVID diagnosis and stabilization of their presenting complaint to one of the isolation facilities. So that is what we're doing as it relates to trying to maintain services as much as possible at the Queen Elizabeth Hospital while protecting our staff and the public of Barbados.
I'm at home. I have a little bit of a fever or a bad headache. My nose is running. Maybe I'm eating some, I don't know, cuckoo and saltfish, and doesn't quite taste right. Should I come to the hospital? Is something wrong?
We're asking persons who have obvious contact history with someone who was in isolation facility or has a high suspicion of COVID or the symptoms that have been outlined, respiratory complaints, whether you think it might be sinus related, ENT complaints, or a mild flu-like symptoms. If you're having loss of taste, loss of smell, you should call the COVID hotline, 536-4500, and present your symptoms to them, and they will offer the advice. We do have polyclinics around the island who stand ready to assess persons with mild symptoms, and we're discouraging persons with mild symptoms from coming to the emergency department. The emergency department really stands ready for those with moderate to severe complaints. Those people who are so short of breath, their sentences are not made complete. If you're having chest pain, if you really are not breathing properly and your relatives don't like how you look, the emergency department stands ready to offer care and assistance for the moderate to severe complaint. If you are presenting to the emergency department because you're unsure, that is fine. You will be assessed and triaged on entrance. So there's an assessment area or a pre-assessment area where your vitals will be taken, a history. We're asking you specific questions to determine your level of risk and assess your level of severity, and we may refer you to the neighboring 24-hour polyclinic service at the Winston Scott Polyclinic. That is because, again, we're referring you to the appropriate facility for your level of complaint so that the emergency department can continue with those persons with life-threatening or severe illness.
Thank you very much. I'm at the risk of really persisting. I'm trying to, there's been concern expressed by members of the public that I think it's the question of the balance of when they actually take the decision to come for help, because we've had some persons die in A&E, which suggests maybe family members are waiting too late. How does one make the decision between this is the time to go?
Yeah, so I'm encouraging you to seek medical attention. I'm encouraging you to call for help. So the COVID hotline has a team of healthcare professionals which will offer advice. You can also call the Queen Elizabeth Hospital Help Desk, 536-4800, and we can offer advice. We're not asking you to stay home to see how you will feel over the next 24 to 48 hours. We're asking you to call for advice. And the advice usually would be to seek medical attention, but where the medical attention, the destination will be dependent according to the complaints that you're presenting when we're interviewing you.
Thank you. Thank you very much. I think that is now a lot more clear for the public, and sometimes we have to say things more than once. We think we've said them and that people have heard, but really effective communication and getting response has to do sometimes with repeating, saying it several times, saying it in different ways, and then people do get the message. I know that the AG wants to come back in to make a point. AG?
Yes, thanks, Liz. I did earlier say that the only entity that is responsible or that issues emergency passes is the government of Barbados. And the one wrinkle that I'd like to indicate in that regard is that we've agreed that the QEH has 2,300 members of staff. So instead of issuing 2,300 passes to the QEH staff, we've agreed that for the purposes of demonstrating that you are a member of that emergency service, that you may use or that you should use your staff ID if you are stopped by the police. The other area in which we've changed things somewhat is in relation to farmers. The Ministry of Agriculture has for the longest time been issuing farmers' IDs to individuals involved in farming, and therefore we have agreed with that ministry since the first ever shutdown last year that farmers would be allowed to present their ID as proof of their bona fides and their farming activity. And that serves two purposes. It reduces the amount of processing that the Ministry of Innovation, Science and Technology would have to do as the many requests for passes coming in. But perhaps more importantly, the Ministry of Agriculture is best poised to say who the bona fide farmers are. And therefore, the members of the Royal Barbados Police Force will be accepting farmers' IDs, fishermen's IDs, and QH IDs as evidence of their entitlement to be on the road during this during this current period of lockdown. And that's the clarification. Liz, over to you.
Thank you so much. We have a full media house. Ms. Wendy Burke of Starcom, Mr. Colville Mounsey of The Nation News, Mr. Ian Bourne of Bajan Reporter, Mr. Randy Bennett of Barbados Today, Mr. Ryan Brooms of CBC, and Ms. Katrina King of The Loop News. Ladies and gentlemen of the media, my panel is yours.
Go ahead. Go ahead, Ian. Oh, okay, go ahead. Okay, no problem. All right. Yes, two questions. Firstly, on a point of clarity, AG Marshall, you mentioned that persons are required to stay home during the daylight hours. I think that many Barbadians were under the view that during the daylight hours during the week, it was discretionary. But you seem to be implying that or saying that there is some legal ramifications to go out during the day. Could you just clarify that for me? Are the police now going to be cracking down on persons going out during the day? And also a question for Commissioner Griffith that he can mull over while the AD answers that. How taxing has it been so far for the force in terms of policing this curfew, and now that there is now going to be the additional week curfew, how much more taxing do you anticipate it to be?
Thanks for the question. I'm happy to clarify. In my opening statement, I did say that our concern has been that Barbadians are taking to the roads, notwithstanding that they are not engaged in business with either the essential services or one of the exempted businesses. It is therefore clear to us that we need to do something. Now let's remember that we have a new directive that started at midnight last night and that will end the end of February. So let's purge our minds of what happened yesterday, what happened the day before, what happened 2 weeks before that. The current directive, directive number 4, stipulates that you can only leave your residence during the daylight hours, and I'm going to read it for you. If you are an owner, operator, or employee of a business or an establishment, which is found in this schedule, in this directive, or if you're transacting business with such an establishment, or for the purpose of visiting a beach or park, for the purpose of doing exercise, if you are currently involved in the COVID-19 vaccination exercise, either as a service provider or to receive a vaccine, or if you're involved in the Operation Seek and Save program. So essentially, if you fit into any of those categories, you have an entitlement to be outdoors, to be on the road during daylight hours, but only if you fit in those categories. So if you are not in those categories, then you are required to stay at home. So those people who felt that it was discretionary and that they could stay at home if they wanted or that they could go out if they wanted, that discretion has effectively been removed. So that only if you are going out to transact business with one of those exempted services, or if you're involved in the essential services, if you're getting a vaccine or giving a vaccine, or if you're involved in Operation Seek and Serve, will you be permitted, will you have an excuse to be on the road? So the concept of discretion is very largely eliminated in this current directive.
Morning, Attorney General.
Sorry, Ian.
Commissioner, before you, if you don't mind, Commissioner?
Sure. How taxing? Extremely taxing. The men and women of the Royal Barbados Police Force have been going for an extended period now under some very grueling circumstances. However, one thing I must say is that they have been holding out well. They are mature officers. I must say the force has matured well, and I have to give them kudos for enduring the long haul. Every member of the force has been giving it their all, and so even though it's taxing, we will come through. The resilience is there.
Yes, good morning. I was wondering if the same way that there are special numbers to either call or WhatsApp for vaccination with Digicel and Flow, if there's going to be a similar service provided for acquiring the same passes that the Attorney General was just speaking about. And if, for the benefit of the public, if it could be reminded what is the email address that people go to apply for these particular passes. And the reason that I'm asking is because one of my readers, they have poultry, but the poultry is at another place and their residence is separate. They have not acquired a pass. Now, this morning, we're hearing that farmers, that once they have appropriate identification, should be able to show that to officers. So I'm doing this in the essence of clarity for the public.
Quickly, Ian, first of all, let me remind that the arrangement in relation to farmers' IDs, in relation to QH IDs, in relation to fishermen's IDs, predates this current set of directives. This was a protocol that was established since the first shutdown in March of last year. In relation to where, there's no hotline number in relation to accessing an emergency pass, but I'll repeat for you the website that you need to go to if you need to get an emergency pass. www.gov.bb. www.gov.bb. So the individual that you just spoke of who has a poultry farm, they ought to have a farmer's ID. I'm assured that farmers' IDs can still be applied for and accessed even as we speak. The Ministry of Agriculture at Graham Hall is still open and is still processing those applications, and therefore any farmers should really make their way to Graham Hall and make the application for their farmer's ID. www.gov.bb for all other persons.
The public transport sector. Some of the associations have been in contact to get some clarity. I've read in the directive that you're saying that the Constitution terminal must check in for sanitization, etc. But in terms of our lockdown weekend or stay at home, are PSVs considered an essential service? And will they be given passes or allowed to use their PSV IDs, or do they now have to apply to get those passes?
An essential service. That is not stated in the directive. That is in fact stated in the order, which is a document that is the foundation for the directives. It's just that the order is constant, so we keep making reference to the directives since we change the directives from time to time. But I think you're very observant. Implicit in the fact that within the directive we do make provision for PSVs, it would tell you that we anticipate PSVs to continue their work. PSVs are not affected by the stay at home weekend simply because there are members of the essential services who need to get to and from their workplaces. Everybody doesn't have a motor vehicle, and therefore people will still, those people who have to be on the road, whether seeking medical attention, going to get a vaccination, going for health care, or just going to work at one of the essential services, they're entitled to expect that the Barbados government will ensure that public transportation is available to them, and therefore the Transport Board, the members of the TAP program, and PSVs will be allowed to operate. But bear in mind that the COVID protocols will be strictly enforced in all of those vehicles as well, and in relation to their usage.
And up to you, just to clarify, the taximen must, however, though, apply for special passes.
Taximen must have a special pass, and many of them have been applying. They've been applying through their various cooperatives, through their associations. Individuals have also been applying. So taximen will have to have passes. On the question of taximen, though, it allows me to segue, I think, very nicely into an issue that I think Lisa Cummings, has dealt with, but let me reiterate it. Individuals who are traveling out of Barbados or who are traveling into Barbados will be facilitated by the members of the Royal Barbados Police Force without a requirement for a pass, so that a person who is traveling tomorrow, or who is traveling today, or who is traveling Saturday or Sunday, the logistics of getting a pass for them simply is a challenge, and therefore they're very simple means of demonstrating to the force that you are traveling. You will have a passport, you will have travel documents, and that would satisfy them that you are in fact a bona fide traveler. Same thing for a person who is traveling in. So we really don't need individuals who are booked to travel out on Saturday morning inundating the system for requests for passes for that purpose. Your travel documents and your travel documents, your plane ticket and your passport would suffice as proof of your bona fides to be on the road, in particular during the stay home weekend.
Benefit from Barbados stay here. Just wondering, have you received any reports of price gouging during this lockdown? There've been some concerns from Barbadians that the prices in the supermarkets have been more expensive than usual. So we're just wondering if you've received any reports of price hikes, price gouging, and anything of the sort.
I think that it will be fair to say that as far back as last year, when we first had our shutdown, there were allegations of prices skyrocketing and so on, and the government did engage the private sector, and in some instances they were able to offer what appeared to be reasonable explanations. Those reports, though, are not destined for me. Minister Kerry Simmons, who has responsibility for those kinds of matters, and it in fact is his ministry that is by statute required to deal with price control issues if there is price gouging. It is his ministry that deals with that. I am able to assure Barbadians, though, that from the time we took the decision to come back into a lockdown, that one of our first focal points was the issue of price gouging, and that ministry has already begun to consider the issue of whether in fact there has been price gouging, or if any increases in price are not a natural result of market forces. So far as I am aware, being a member of the Cabinet Subcommittee and relating with Minister Simmons, we have had no instances or no grievous instances of price gouging reported, but being monitored on a constant basis.
Yes, if we may return quickly to the Commissioner on the issue of capabilities of the police force at this time. We are getting reports that a significant number of some members of the criminal division have tested positive for COVID-19. Again, could you just illuminate the public on how you are handling that on that front while dealing with these issues of crime prevention, as well as patrolling within the curfew, ensuring that persons are adhering to the curfew?
Okay. First of all, I think it's a blessing that we have one police force and not 4 or 5 different police forces. And so, even though there are units within the organization that are hampered from time to time as a result of persons being either positive or of the view that they might have been exposed to the virus, we operate as one police force, and so all the resources that are available to us are utilized on a daily basis. So detectives, whether you're from the North, the Southern Division, or the Bridgetown Division, all pool, and whatever matters are there to be investigated, we move out and ensure that they're properly investigated. So the public is not in any way short-circuited as a consequence of the issues at the CID. We are starting to get some results back at the CID, though, and so things are looking up in that regard.
A question. I'm not sure if it should be the AG or Commissioner. Good morning, Commissioner. This is in regard to the fact that gas stations are going to be closed for the weekend, and yet you're going to have private security firms that will be making their rounds to ensure the safety of the property of their clients. What is going to happen with them in terms of refueling? What is the recommended procedure?
Thanks, Ian. The recommended procedure is that businesses plan their affairs. Plain and simple. I went to school at, I think the last school rule, or maybe it was the first, it said, a breach of common sense is a breach of the school rules. It was the first one? Yeah. Well, that tells me something. But the point is, if you know today, Wednesday, that gas stations are not going to be open on Saturday or Sunday, it would stand to reason that you will make satisfactory arrangements to secure fuel. And I don't think I need to go any further than that. This is not an ordinary circumstance. Every Barbadian has the benefit of notice that on Saturday and Sunday we are going to be in a state of quietude, plain and simple. So if you have Wednesday, if you have Thursday, you've known about it since yesterday. So we expect Barbadians to plan ahead, but you know, don't go overboard, but plan ahead. So businesses that can anticipate having to move people, we ask them to plan their business accordingly. I don't think it can go any further than that.
I'm here from CBC. I have some follow-up questions in relation to the passes. One of them, first of all, relates to how long exactly does it take to get a pass? Because I'm being told here by a few people that they've applied for passes and haven't gotten any response. So do you get a response if it's a no, or you only get a response if it's a yes? And then two very specific things. One from the fishermen who want to know if they'll be able to check their vessels, because I think some arrangement was supposed to be made in terms of checking vessels. And then also caregivers also want to know if there be any provision for them as well, because one other one, there's a nurse who her husband drops her to work.
Ryan,
and,
don't go so fast. You run the risk of me forgetting what the first question was. So fishermen, let's deal with fishermen. The last few weeks have seen a lot of north swells. We've had a lot of high surf and so on, and we have made it quite clear to all members of the boating community, not just fishermen, but also individuals in the recreational boating community and the tourism boating community, that they are entitled to check their vessels. Plain and simple, you are entitled to check your vessels. It would be reckless of us. It would be wrong for us to stop people from doing so. The sea is an unkind mistress, and therefore we've made it quite clear to the boating and fishing community that they are allowed to check their vessels. In relation to caregivers passes have been given out, have been given to individuals. I can't say routinely, but people have been asking for and receiving caregivers passes. The arrangement for caregivers passes is somewhat different. You apply in the same way to www.gov.bb, but requests for caregivers passes get directed to the Ministry of Elder Affairs, and therefore they don't come to the AG. They don't go to Colin Jordan. They get sent to Minister Cynthia Ford, and she goes through the exercise. She and her team go through the exercise of trying as best as possible to determine bona fides. Now, let me be frank. There are people who request caregiver passes. Some individuals have requested as many as 8 or 9 caregiver passes for a single individual, a single elderly relative. So all kinds of people are asking for caregivers passes for just one individual. So they have to track that. And then of course there's some individuals who have nobody to care for, but who try to beat the system and apply and say, well, I am a caregiver. So to the extent possible and reasonable, we still have to engage in some kind of vetting exercise. Otherwise, we will just be giving passes to everybody who applies at www.gov.bb. In relation to delays, unfortunately, the system doesn't have a prompt to say, no, you've been refused. But in some instances, in many instances, individuals don't complete the field correctly. They don't follow the requirements. They will email and ask for a pass, but they don't say what the pass is for. They will hear that the AG issues the passes, and then they email me, or they email the AG's office. And so we have 700-800 emails for people who want passes. I don't see them. The Secretary of the Ministry has to see them, and then she has to respond and say, go to www.gov.bb. Now, perhaps we could do a better job of using that language, go to www.gov.bb, but in the directive that came into force on the 1st of January, that direction is found there specifically. So people are trying to get past all kinds of ways, but they're not following the process. Go to www.gov.bb, complete the documentation, complete it in the way that's required. So some people, they need to put in a mobile number, they put in 230-4040 without appreciating that for the computer it gets rejected because you need to put in the prefix numbers 246. So be patient. Sometimes we have there's a vetting process. Common sense always operates, and therefore it's not a case where you just apply for a pass and it's sent to you. There's a lot that goes on behind the scenes to determine your eligibility. So just be patient.
Particular matter, there's a nurse who had contacted us who says her husband drops her to work. She doesn't work at the hospital, at the QEH, however. So her concern is when he's going back home, having dropped her off, if he's stopped by the police, because obviously he wouldn't have a pass to present. What in such circumstances like that, is it discretion on part of the police, you hope, or is there provision for that helpful husband?
When this issue first came up with the QEH, because they said they have 2,300 staff members and they're working around the clock, and you'd realize that if you have 2,300 staff members and half of those don't drive, and then we have to give a pass to the person who drives them, you see what's happening. And of course, the person has a pass, drops to work his sister, and then he goes gallivanting all down in Checker Hall, Bathsheba, and so on. So there are some practical difficulties. In some instances, when we issue specific passes, then we put in the system that it's to be revoked within a period of time. The point is that we try to put checks and balances in place. Individuals who require someone to ferry them to and from work, to the extent possible, we will accommodate the individual. But you would appreciate that it's not a desirable arrangement, because a pass is a document on your phone. Then once you've dropped off your charge, then you have carte blanche to pretty much to do whatever you want and where you want. And in that regard, we've said to the police that they have the full right to indicate to me as AG that a person has been abusing the pass, and if I receive any such reports, the pass will be revoked. Plain and simple. So if a person has a pass to drop work, his wife or his sister, and the shifts start at 7 or 8, and at 1:30 they're someplace else in Baxter's Road or wherever, or still on the road, the police are entitled to say, sir, you are abusing the privilege of having this pass, and we're going to recommend that the AG revoke it, and believe me, I absolutely will.
Yes, I have a question for two questions actually, for Dr. Shaney Williams. You mentioned that elective surgeries have been, and the procedures have been curtailed somewhat. Could you give me an idea, and I know that has been in place for a while now, could you give me an idea of the backlog that you're experiencing at the facility, at the primary QEH facility? And also, there has been, some trauma within the QEH as of late with the death of a member of staff, as well as I do understand that persons were heavily vested in trying to save that child unfortunately passed. What is the morale like of members of staff at the moment at the QEH?
Thank you. The Queen Elizabeth Hospital has a cadre of dedicated, hard-working, committed staff members. We as a fraternity are undergoing the grieving process. One, because we've lost one of our colleagues, and two, yes, we've had a minor who several of the pediatric team members were involved in trying to save. So yes, It is hard and trying times in the background of managing the pandemic for at least a year now. The morale will wax and wane, but I cannot say it is unnatural. We are all human. We have families. We have feelings. But the one thing I can say is that our team members come to work and they give their all every time, all the time. As it relates to the backlog, we have to recalculate because there were many reasons in 2020 that elective surgeries may have undergone stop and start. So some procedures which were 3 months have increased to 10 months. And then later in 2020, there was a significant drive to try to decrease that backlog. So now it is less than that, but the exact value, the exact backlog for some procedures, not all, and is not in general, it may be on a specific service for a specific condition, can be fairly significant.
Good morning.
Hi, good
Dr.
morning.
Williams. This is Wendy Burke, Star from Network News. This morning, I had some concerns raised about A&E and how you're processing people. There is apparently a senior line where there's some chairs outside A&E. Who can't stand, you have the crash bars set up for proper lining. However, a number of folks who would have dropped staff members off this morning have some concerns about how those seniors are bundling as well as those in line. Is there anything else that you can do for those waiting to come into A&E to prevent this sort of situation, which in and of itself is one of the things we speak against in terms of the transmission of COVID?
I'm not sure if you mean to access A&E as opposed to the main entrance of the hospital, because there's no real crowding and bundling for the emergency department. Most persons are allowed to wait socially distant apart in the A&E. Recall that is near the makeshift entrance area, is near where the construction zone is. So I just want to clarify if you mean the main entrance of the Queen Elizabeth Hospital, because yes, we have separated persons according to the services that they're trying to acquire at the hospital. So please clarify.
Dr. Cave spoke to that separation. It's not that. The persons are saying that even though you're supposed to be separating, they are peak hours where they're still finding too much bunching out there. And it would be toward A&E because it's where the ambulance does the drop off. That's the area that they have concerns about.
If I misunderstood you. So yes, from time to time, we may have situations of overcrowding. That is true. But that's one of the other reasons why we're discouraging non-patient populations from coming to the emergency department. And that's another reason why we have expanded the emergency department and also engaged the field medical facility, which is on the roadside of the Queen Elizabeth Hospital, so that patients can be housed in a more comfortable setting, socially distant apart or physically distant apart appropriately. The waiting area still has the spaces where patients can sit, for those who are well enough to sit, physically distanced apart. When we recognize that there's crowding, I think every effort is made to control the crowding. We have security officers there, which will flag that particular challenge, and operations will change to reflect a decrease in the volume of patients on the outside if that is occurring, or if there's any bottleneck.
My question now is for the commissioner. Commissioner Griffith, yesterday the Minister of Health would have noted that your department is now on the case of investigating that leaked list. I don't know if at this stage, you're able to shed any light as to how that particular investigation is going, as well as some of the other online issues that we've been having, which warrant the needs of your force.
We are investigating the what you term as the leak. We are certainly investigating the matter, but it's very early in the investigations. So there's not anything I can say at this stage in relation to where that's going.
Have you received any business ministry about some fraud being carried out by a couple business persons in terms of trying to secure loans and doing a number of fraudulent things during this particular period? Have you?
Not at this time. Not at this time.
Okay, thank you.
Thank you.
Hi, good morning. Katrina Kane from Loop News, Barbados. I have a question for the Commissioner of Police, Mr. Griffith. With regards to the force, you would have had several police stations that would have had to temporarily close their doors because of positive cases. What has the force been doing to ensure that COVID does not spread among the ranks? And also, how costly has the COVID pandemic been for the police force?
What we have been doing, advising our people to follow the protocols and follow the protocols to the T. And that is what hopefully they're doing. The force is a relatively big organization, and sometimes I get the impression that people don't think that the police is part of the society. But we are members of the society. We have families in all parishes in the society, and so it's quite possible that we will be affected from time to time, just like other Barbadians. In addition to that, the nature of our work is such that we are always interfacing with members of the public. So there are issues there, but certainly we are trying to follow all the protocols to ensure that our people and their families are safe.
How costly has the COVID pandemic outbreak been for the police force, because you have to shut your police stations a number of times?
Right. I was wondering what you meant by costly. But obviously, having to shut any one police station creates a demand on other police stations. So it is indeed costly if you're speaking about it in those terms. But as I said before, the public service has not been in any way, it has been challenged, but people are still getting the level of service that they require. So far we are doing quite well.
And also another question for the Attorney General. With regards to persons who might be special needs or suffer from Alzheimer's and dementia, they routinely take walks throughout the course of the day or on the mornings. What advice would you give to members of the families who will be helping these individuals? Or what can be done to help these individuals?
Interesting question. I wonder where you should begin. Dementia, I've had personal experience with dementia. Lost a dad to dementia recently. Let us remember that legal responsibility relies on an individual being compos mentis. So there's no sense in which a person who is affected by dementia in any of its forms, who might breach a protocol, there's no sense in which that individual could be found culpable before a court. They would not, in law, have the mental element sufficient to be able to be brought before the court. In other words, it would be impossible to prove that they intended to breach a protocol. Now, I would be most surprised if a member of the COVID monitoring unit or if a member of the Royal Barbados Police Force would want to pursue a charge against somebody who has dementia. We have to accept that mental illness is a challenge for our society, and the only advice I could give to family members of a person with dementia would be given not from a point of view of being an attorney general, but would be given from the point of view of a person who is had to live with it and stare it in the face. People who have mental illness require or understanding, or care and affection, and or tolerance. And it will be difficult to get them to keep on a mask. It will be difficult to get them to stay physically distant. But there are some things that there's a point at which the law stops and humanity begins. And that's the best advice that I could offer.
With regards to persons, family members taking these individuals on walks in the morning, for example, because it's a stay-at-home order.
Ma'am, there's a stay-at-home order. That is the beginning and the end of it. If a person, because of a medical condition, is required to engage in particular kinds of activity, and that is known, then I have the ability, I have the lawful authority to grant an exemption. If there's a special instance, then that person should apply for an exemption. We've granted special exemptions since the year began, so as to accommodate people who have medical conditions who require to be excused from complying with particular elements of the protocol. It's not new, and if that is absolutely required, then I would certainly consider it.
AG, we are going to give the final questions to you. They have come in from people who are following. The fishermen of St. Lucie are asking, thanks for the offer, for the opportunity to go out and check the boats, but what about fish pots along the coastline? And I think you would say if they don't have them out already, don't put them out now. And the last one, and then you can give the answer. And this other one is for those who are intending to go, those 10 persons who are going to go to the church services on Sunday, do they require a pass to be in attendance at these particular church services? So you have the final question.
Okay, so in relation to the fishermen, in the same way that the government of Barbados has not stopped people from farming, from keeping chickens, from raising pigs, from taking care of their livestock, in that way, in the same way, we have made no prohibition from people fishing. So individuals, fishermen, can still fish, okay? And operating a fish pot is just another form of fishing. And therefore, from my point of view as AG, but also having had the benefit of discussions with other members of the Cabinet Subcommittee, there is no issue at all in relation to fishermen going out and retrieving their fish pots and even setting their fish pots. It is just another form of fishing. Barbadians need the fish just as we need the potatoes and the pork and the chicken and everything else. But remember, please, that fish markets are closed. So that's the clear distinction that we need to make. Fish markets are closed. They're closed to retail trade. And therefore, commercial fishermen have to be cognizant of the fact that if they go out, then they will have challenges in terms of being able to move their product. But in no sense have we ever taken a position that fishermen are prohibited from going out to fish, and that would include whether they go out long lining or using nets or using fish pots. And the second question, Liz, was, remind me please?
The church, people who want to actually sit in the church on Sunday as part of the 10 people who will be present.
Apply for a pass in advance. I've already, for the morning, been in touch with a member of the Anglican congregation who has reached out to me, and they're going to apply for passes. Apply for a pass. I do not want to have the police looking at you to determine if you have on Sunday go to meetings in order to determine if you are bona fides, because a lot of churches these days, Liz, where people dress actually very casually. So if you are going to be on the road, have a pass, please.
Thank you, AG. I think that is a very good note on which to end. I am going to, as I normally do, I am today going to do a synopsis, starting with the Commissioner of Police. The Commissioner notes that to date there have been 20 curfew cases and that the force is moving to a position of zero tolerance for those who breach the curfew regulations. That if you see something, say something, because those somethings can save all of us. He was very clear that the time has come to take very firm action. We have been encouraged to call by Dr. Shaney Williams to call the COVID hotline 536-4500 and the QEH hotline 536-4800 in the event that we have symptoms, that we are feeling unwell, that we are uncertain whether our symptoms may be dengue or if it's COVID, if a family or family member, relative, or somebody in our household is looking a little sick and we are unsure how to deal with it, these are the numbers that you call. Do not wait for the person to get severely ill. Seek help quickly. We have learned also from Dr. Shaney Williams that because of long planning, while the situation with COVID is stressful all over the world, that the professionals of the Queen Elizabeth Hospital have been managing to put measures in place to cope, and that the staff is remaining safe through the extensive use of PPE. We had heard previously from Dr. Ford that the vast majority of cases of COVID amongst QEH staff are really the consequence of community spread and not patient to caregiver contact. This weekend, we move from pause to stop. There is a new directive. There will be no beach going. There will be no parks open. You cannot, if you are an essential service provider, issue your staff members with a letter to give to police officers. You need to get genuine passes. The police will act only on genuine passes and not these letters issued by employers saying, look, ease my staff member, be essential. You are supposed to stay at your home and not go to anybody else's place. The AG has told us, and it is important, that those shopkeepers who have closed the front of their stores but ease people through the back door or through the side, don't expect then to come to government for compensation and for the some of the resources and the grant that we are giving to shopkeepers. You have been in breach. You no longer qualify. Therefore, shopkeepers, business people, follow the rules. If you want a pass for, say, a caregiver, for a parent or a relative, the place to get that, or for any other reason, an emergency pass, www.gov.bb. That is where the application goes, and it is issued if your situation is legitimate and reasonable. Staff members of the Queen Elizabeth Hospital do not need to apply for emergency passes. Their work ID, the QEH staff ID, will suffice if stopped by members of the Royal Barbados Police Force. Farmers, if you are a farmer and you are a registered farmer, you have an identification from the Ministry of Agriculture. That too is enough for you to show to a police officer. You will not require to apply for an emergency pass. For the rest of us, we're going to be at home. We are going to follow the protocols. We are going to wear our masks, and we're going to try to keep them on even if we're in the house and other staff members, other family members are close to us. We're going to wash our hands often with soap and water. We are going to sanitize regularly. If we don't have soap and water immediately available, we are going to do our utmost to stay 6 feet away from other family members insofar as we can. And if we can't, this is where wearing the mask becomes important. If you are waiting for a COVID test result, it is of critical importance that you do not socialize, you do not go out, you do not go to work, you follow these protocols to protect your family members and your household until such time as the result is in your possession. It is up to us to take the necessary steps to beat back COVID in Barbados. We all have a personal responsibility to do as government is directing us, from pause to stop, so that we can stop the spread. Good afternoon to you.